Good afternoon, everyone. Thank you for joining us today for another session of Accelerate Your Research series. Today's topic is going to be on open access publishing considerations for researchers. Our speaker today is Kate McGraw from UNC Health Sciences Library. Kate is the Assistant Department Head of User Services and Librarian to the School of Dentistry, and she'll tell you more about herself in just a moment. So I'm going to turn it over to Kate. Thank you.
Well, I think everybody here can probably hear me. I do tend to fade as I get into talking, so if, do I need to have that connected to anything? No, okay. So if you can't hear me, please let me know. All right, come on in. So as Jennifer mentioned, I am currently the Assistant Department Head for User Services here at the Health Sciences Library. I've been in this position about 15 years, and one of the ways in which this position impacts my interest in open access is that I am often the person who communicates with people who want to know if they have access to the Health Sciences Library resources. So I'm very aware of the desirability of collections like we have at UNC, and also the number of people who do not have the same ready access to information that we have. My interest in open access probably precedes that. I'm actually a second career librarian. I've been a librarian for about 20 years. My first job was at the Enoch Pratt Free Library. I'll emphasize the word free. So a public research library in downtown Baltimore, Maryland. And in my work there, I really came to understand the limit that access to information places on people in all kinds of situations. The department I worked in worked quite heavily with consumer health, so people who were looking for information about their health, as well as with people who were trying to start small businesses. So in both those areas, the limits that we had on the information that we could access impacted people's lives. So that has always made this topic of interest to me. When we first started exploring it from a more formal avenue in the Health Sciences Library, I was active on the committee that was looking at ways in which the library could support researchers who were interested in publishing in open access journals. So when I thought about putting this talk together, for some reason, this phrase, information wants to be free, started playing around in my mind, probably going back to those first days of my librarian career as the internet was just first developing. And there was a lot of interest in thinking about the impact that this new tool and new capability would have upon our access to information. I am particularly pleased with exploring this particular phrase in Wikipedia, the free online encyclopedia, which I think not all librarians support, but I find to be quite an amazing resource of our combined information if used carefully. This seems to be a topic that was fairly well researched, and what I didn't know was Stuart Brands, who has been the person identified as linked with this very clear articulation of this idea that information wants to be free, actually couched it with a much more complicated statement. And this was both speaking at this Hackers Conference back in the mid-'80s, and then also publishing it in a book where he was recording some of his thinking. And I think it's important to understand that that little phrase that we often use to talk about what we wish the internet would be, it was actually from its very beginning embedded in this more complex understanding of information. And I'll let you just look at that for a minute. I particularly like the sentence, it wants to be expensive because it can be immeasurably valuable to the recipient. So there are times when information is worth its cost. So let's go back. I think in order for us to understand where we are now with open access, we do have to see it grounded in that beginning of the World Wide Web. Actually, the exploration of publication in open journals started before the World Wide Web, when it was just the internet, file-based sharing. So you can see some of the OAD wiki, which has tracked publication and scholarship about open access, has a very nice timeline which they've started to gather information, and they have this list of early online peer-reviewed journals just to give us this understanding that this is not a new idea, but something that started before we even had the easy access through the web. When I came back to this slide, this is actually slides from a talk that I gave earlier this fall, I was thinking, well, I wonder if any of these journals still exist. And so I did go looking for the first one and the last one. I didn't have time to look for all of them. The first journal does still exist as a subscription-based journal that is now an open archive journal. In following the information that was in the OA Wiki, I found that an article by the creators of this journal, and I just thought I'd share with you. Here is the standard-looking journal webpage, which is how they distribute the journal now. In its first days, it was established as an email file sharing journal. So you sent an email message to a remote file server saying that you wanted to subscribe to the journal. You received a table of contents when the journal was published, and then when you selected the articles you wanted, you sent another request back to the file sharing internet and received the article that you wanted in ASCII format, plain text format. So if we think that we haven't made progress, I'd argue that we have been progressing over the 15 years, if only in the accessibility and the format that we can bring to the content we're putting on the internet. The other journal that I looked for, the Journal of Computer-Mediated Communication, I had to dig around a little bit on the site to be absolutely certain that it's still an open access journal, but it is still open access in the traditional sense that articles are freely available upon publication. It is, however, now offered on a standard journal platform, the platform provided by Wiley Publishers. At the same time that we were moving journals online and exploring journal format, we were putting databases online. You have journals, you need to find the journals. And so here are just some important dates in that timeline. For those of us in biomedicine, certainly the launch of PubMed in the late 90s was central to a major change in how we do our work. And I would say that in the early 2000s is when we actually started having something that was known as open access. I haven't yet found that first use of that phrase. I don't think it was back in the 90s. We were talking still just about format and electronic journals. But Biomed Central certainly, as one of the first publishers of a platform for open access journals, and also the first journal that started paying for access by charging authors processing fees. And this has become a model for a good portion of the open access journals that exist today. Public Library of Science also, from its very beginning, charged article processing fees, but at a lower fee level because they received a grant to explore the establishment of that journal. And at the same time as these journals were starting to develop, the directory of open access journals was started as a way of finding them. And this is still the primary way to find a journal in a particular field that is publishing in an open access model. Also in the early 2000s, there were a number of different declarations made public, and people signed on to these declarations supporting the concept of open access. These three declarations have kind of risen to the top as being the ones that people turn to and are actually known as the BBB declarations because they're very similar. And the declarations were defining what open access is, this format of open access, that these are journals that the articles published in the journal are made freely available at the moment of publication. Has come to be known as gold open access. And just to show you that there are other kinds of open access to the literature that exists now, Open Archives, remember that Electronic Journal of Communication now is an open archive journal. It becomes freely available after about a year of publication. So these journals usually after 6 months to a year after publication make all of their back issues freely available. And there are journals like this in many, many fields now. And I would argue that they followed that model in response to the exploration of new forms of publication that open access has provided. So they weren't ready to take the step to being fully open access. Their business model wouldn't support it, but they have found a way of providing content freely that fits within their business model. And then open repositories, so these would be things like institutional repositories or PubMed Central, the NIH author manuscripts would be an institutional or subject repository, and that's known as Green OA. So there's not one thing that is open access. So just a little bit of information about the directory. It is a directory of gold OA journals. Now that doesn't necessarily mean, gold does not necessarily mean high academic quality. I think it's important to state that. There's certainly a variety of quality within the journals that are in the directory, but they do have some quality filters that they place on collecting these titles. They are looking for journals that have some form of peer review and that are reporting research. So it's not just any open access journal. To continue this idea of open access being something that has been evolving over time, I looked at the research that's been done recently using the directory of open access journals over time and has done an analysis of the existence of open access journals and the publication of open access articles. So this is data from one of the research studies that was published in 2011, and you can see the dramatic growth in both journals and articles in that time period. This early period we were talking about before was termed the pioneer period, and they're now looking at this as a model that they think they see this growth at this level of development to indicate that this is an idea that has been embraced and will continue to go forward. Here's the data in a text version showing the growth over time. So an annual growth of about 18% for journals, 30% for articles. This is greater by far than the yearly growth in scholarly publication in standard journals. And I think it's interesting to see that at the end of this study, for 2009, the percent of articles in OA journals had reached 7.7%. A similar study that carried the data through 2011, and I thought that one of the reasons I wanted to pull this in, you're seeing the numbers continue to grow in terms of articles and journals, but here they showed the number that have article processing fees charged. And I don't know, do you see this number? Is this number surprisingly high or surprisingly low to any of you? Do all of you assume that an open access journal would charge its authors for publication? Is that the only model that you think of? I think in biomedicine we certainly tend to think more about journals charging authors to publish. But it's very clear that there are other business models out there for these journals. And as I mentioned, biomedicine, it is certainly one of the key players in the growth of open access publication, as you can see in the data here, 16-fold growth between 2000 and 2011 in just that subject area. And then just to bring you up to date, as of January, this is the number of journals and journals that are searchable at the article level, and the number of total articles that are accessible through the directory of online access journals. So what impact does open access have actually on, not just on this kind of global idea of there's this publication going on, but what you all want to do is get access to information in a particular topic. So I thought that this article was an interesting article in that it was analyzing the impact of open access on access to the HIV vaccine research literature. And it looked at it not just from the perspective of access from a place like UNC, but it's looking at it globally. So when you look at the most recent, the data was pulled from 2010. The most recent 50 articles on this topic in PubMed, 20% of those journals were open access, which means anyone, anywhere can get to that research. Any sense, does that feel like a good number? I mean, is this a case where we have a fifth full glass of water? Or do we have a 4/5 empty glass of water when we think about this? And when we think about HIV vaccine research, this is research that we would want anybody, anywhere, and particularly in resource-poor countries, to be able to get to. And what this is saying is that in the recent articles, there's a barrier placed to 80% of the articles. So unless you have some kind of institutional access to those subscriptions, you're not accessing this research. Here is the impact of the green OA. So these articles, these 200 articles, are drawn from the articles cited by these 50. So they randomly selected 200 articles from those articles. And you can see the impact of green OA. So yes, if you wait a while, you can start to get more access than you can when research is immediately published. But we all know that in medical research, it's immediacy that counts. So I think that this shows both progress and the limitations of where we are now in providing access to important research information to the people who need it. This is a country analysis, and I'm sorry, I think that this is a slide that I did download from the journal, so if it's hard to read, you could go back and look at it. But it's looking at, after the open access, how does institutional access play out for people in various parts of the world? This gets to be interesting because this column right here, the second column, the HANARI column, is the way in which low-resource countries, institutions in low-resource countries, can get access to the literature. So if you are in a very poor country with a very low GDP, your institutions can sign up for free access that the publishers provide just to those resource-poor countries. But look what happens to poor South Africa. So South Africa has some of the lowest access to this literature, although it has active institutions that are researching HIV vaccines. But its institutions have the least amount of access because it's not eligible for HANARI access. Its GDP is too high. So even the solutions that we've come up with beyond open access to provide access to restricted articles are only serving some of the people that need to get to that research. So we are still in a place where important information is held behind barriers to people who need it.